here. Good. Dr. Barrie, thank you very much for agreeing to be interviewed. Can you tell us what impact having a super clean home has on our children's health?
I wouldn't have thought that having a super clean home would have per se a direct effect on children's health, but I would argue that you would need to be aware of the routes by which bacteria reach children and then take steps to prevent that happening. So you would probably concentrate on specific areas like the kitchen. I can think of.
So what sort of methods would you advocate in keeping your home, clean and safe for your children?
Oh gosh. Yes, you tell her now. It's a very general question.
I'll ask you another one.
So general.
Okay. So you say the kitchen. Where would you focus your attention on cleanliness? Where do the dangers lurk?
Associated with food that you buy in, food preparation, food storage, adequate cooking, keeping the kitchen clean, keeping the dish rags clean, making sure the bacteria don't survive between the food, and that you reduce, where possible, cross-contamination between food, between cooking utensils, chopping boards, and other clean areas.
So let's look for a moment at some of the things you mentioned. You mentioned dish rags, things like tea towels and wiping up cloths and things like that. Do you think it's a good idea to wash them along with the rest of the family laundry?
If I had my way, one would reduce the number of dish rags. I would use more disposable cloths, not drying up cloths, but disposable things for wiping up. I don't like all this wiping up that goes on and then putting the dish rag to one side to use it again. If you know you've used it on something, you should either have used a disposable one in the first place or have made sure it doesn't touch something else. And maybe I would perhaps, if I were to wash them separately.
So would you suggest that people, for example, don't mix in dish rags with things like children's clothes, for example?
I think it depends on the age of the child. I think when you have a newborn, you have to take extra care to make sure that no bacteria can reach the newborn. I think for a toddler, they meet bacteria so often anyway in other routes, in other circumstances, that I wouldn't have so much concern about dish rags contaminating their clothing. For they don't eat their clothing, and that was the main route by which they would get in.
But a lot of people feel that they have to boil their washing or use a very hot wash, a 60-degree wash.
That would be ideal if one had the time, but now there's a great emphasis on saving water, washing clothes at lower temperatures. Some of them can't take higher temperatures, they can't take bleach, they can't take boiling. So I think if you were concerned about an item then, you might think about using an antibacterial agent or a detergent or a soap with antibacterial properties in it.
Do you think that they offer a real benefit, or do you think they're a sort of marketing con?
No, I think there are circumstances where they would offer a real benefit. I certainly wouldn't recommend using them for all washes, for all types of clothing. But if you, for example, thought to yourself, this may be contaminated and I have a susceptible person in the house, then you would use them then. It would be your choice when you felt you could use them. If you thought, for example, I wish I could boil this, but I know I can't, I haven't the time, the material is synthetic, and I wish I could do something extra, then you could use an antibacterial agent, yes. That would be their role.
Because some people would say that these products are marketed in a slightly sort of scaremongering sort of way, that you might catch
yes.
germs from your washing. Surely it's not possible to pick up germs from your washing.
By and large, it isn't. There is evidence, though, that bacteria do survive the washing process. And I think it would depend on what you did with your hands afterwards. If you take washing out of a washing machine, for example, then common sense would determine that you wouldn't therefore then go and feed a baby under at the age of, say, 6 months. So I think you have to remember what you're doing at all times, what your actions are, and be mindful of what you're doing.
Do you think we're overprotective?
I don't think we're protective enough in some respects when it comes back to my earlier talk about, discussion about food handling practices. We're not fussy enough. But I think that we mustn't go along the other thing and forget about food hygiene and then think, oh, well, everything will be solved by using an antibacterial agent in clothing. One has to have a modicum of sense, a common sense about that.
There has been some coverage in the press recently suggesting that our children, because their environment is too clean, don't develop immunities in the way that they should because they don't meet the allergens that they should, and that actually an over-clean environment is actually unhealthy for them.
I don't know that I have thought that through really. When you were talking, I was thinking that certainly going back 40 or 50 years ago, when people were very ignorant about germs in general, children must have been exposed a lot more to bacteria and other organisms than they are now. Were they less healthy or not? I think on the whole, people do need to beat bacteria. They need to encounter bacteria to develop their immune response to them. So I think one could go the other extreme. We can never be sterile. And I think to aim at it is perhaps being a bit silly.
Thanks very much indeed.